A lot of it starts with denial. There's a lot of minimization that happens, and I think that that is a defense mechanism for people. We don't want to believe that there is something truly wrong. I've had people lash out at times, and I have to just remind myself that this is not personal, right? They're not mad at me, they're mad at the diagnosis. And I can feel that. My grandmother also had Alzheimer's disease, and I understand that angry feeling that you get when the person you love is being taken away.
You have to be honest with people. You can't treat people like they're children. You can't treat people like there's nothing wrong. If they're coming to see you, they know something is wrong. They want to know what's wrong. So think of your heart and your brain as the same.
We know that the MIND diet, which is a combination of the Mediterranean diet and the DASH diet, has been shown to improve cognition in older adults who are at risk for dementia. I talk a lot about exercise, trying to get to that 150 minutes of moderate intensity exercise each week. If you haven't been doing any exercise at all, 150 minutes is not attainable. But I can order you home physical therapy 3 days a week. We just need to get you moving. Sleep hygiene is really important. And also social. Social interactions are so important, and they're such a big part of brain functionality.
It was that attitude of like, I don't even want to uncover this because there's not much I can do about it. And I think it created a generation of providers, and I would count myself in there until I sort of got into this space, who just kind of felt hopeless about the disease.
Before, if you got the diagnosis, get in a clinical study. That's all we have for you. And now we have these things, and it's not so bleak anymore. We have treatments, and there's so much coming down the line. There's hope. Before there wasn't hope.
Yes.
Yeah.
Now there's hope. It's not like caretaking for your baby and for your toddler. It's very, very different. And it is a huge emotional toll on people.
I think caregivers really underestimate the amount of time that they're going to be required to be caregivers. The average amount of time that someone lives after a diagnosis of major neurocognitive disorders is about 8 years.
Make the patient your primary focus, but don't neglect the caregiver. Caregiver burden is real. Caregiver burnout is real.
We generally accept some level of decline, even if it is not normal, and families will just say, oh, well, she's 90, what do you expect? Well, I expect something more, really. This is not a normal part of aging. And I think that also happens with other physicians. They will say things like, well, she's 95. But, this is not a normal part of aging. This is actually her brain not working as well as it once did. And we need to make sure that we are doing everything in our power to identify the problem and keep her safe. Dementia is an umbrella term, and underneath that umbrella are our different types. So our different types can include Alzheimer's dementia. It can also include vascular dementia, can also include Lewy body dementia. And so I talk to people about Alzheimer's is one specific type of neurodegeneration. A lot of people, we've come to discover, have overlapping types. So they may have a mix of Alzheimer's dementia and vascular dementia in the same person. And that happens very frequently.
It's the osteopathic philosophy. You're treating the whole person. You're not treating a disease. You're not defining someone by their dementia. They are not Alzheimer's disease. They are Linda, who is living with Alzheimer's.